Joining us now via Skype is Dr. Lizheng Shi. He's a professor at Tulane University and has practiced medicine in China. Thank you so much for joining us. So 300 million smokers in China, some big numbers there. How has the government done so far in bringing awareness to lung cancer?
Well, thank you, Elaine, for having me. China government has launched a lot of public health initiatives, including a lot of efforts to cut down the smoking, including those bans on the public space. So, but the rapid rise of the disease will last for at least two decades because those efforts will take a long time to show their effects. And more importantly, the air pollution now is likely to replace smoking as primary cause of lung cancer. So the emerging challenge from air pollution should be addressed urgently as well.
What tactic among some of what you mentioned seems to be working so far the best? Is it the ban on indoor smoking? I know that there are fines, there's taxes. There's also a clean air campaign. What, in your opinion, seems to be most effective so far?
I think the most effective so far is really raising awareness, such as this kind of a November, the lung cancer awareness, and then make this social norm change in China, particularly in the Chinese males, because the Chinese male has a very, very high rates of smoking, and that's probably the initiative might be really can change the needles and then really achieving a better outcomes in the long run.
You mentioned air pollution a moment ago, possibly a contributing factor. What more can be done? I know that the government is doing a lot to bring down air pollution. Is there anything more that can be done in the short term?
Well, short term, I think there's a lot environmental health initiative has been implemented in the many cities, closing some really a factories producing the air pollution, the PM 2.5, and all those adding together is not going to be a one-size-fits-all approach. It has to using a comprehensive approach to address this particular problem.
How important is early diagnosis and early treatment, just recognizing that there could be an issue? What sort of signs can people look for to know to get checked out by a doctor?
Well, I think obviously as any practice physicians, they always are asking for early treatment, early diagnosis. There's a lot of new technology has been developed in the pipeline. I think it's going to show a lot of promising. But in general, there's a wide range of treatment available, and people can access to those treatments, including like a surgical approach, radiations, ablations, chemotherapy, targeted therapy. And I think they're very important is that the precision medicine now can match those treatments to gene mutation type, which can really achieving the better effectiveness for those really have getting this disease.
All right, Dr. Lizheng Shi, thank you so much for joining us from New Orleans.